Doctors don't often admit when they're wrong, but I will tell you right now, I was wrong many times throughout my career. On this video, I'm going to reveal 5 of the most prominent things that I have been wrong about over the last 19 years as a board-certified plastic surgeon. Several years ago, I released my most viral video ever, and it was 5 things to avoid putting on your face. And one of those things was petroleum jelly. Now in that video, I told you that petroleum jelly was a byproduct of petroleum refinement, and that is true. But I also told you that you should not put it on your face and that it is potentially harmful and even carcinogenic. That, however, is not so true. Now the fact is that petroleum jelly, if it is completely refined, is safe for your skin. It is completely safe for use. It's just when it's unrefined that it may contain potential carcinogens. And the problem lies with polycyclic aromatic hydrocarbons, or PAHs. Petroleum jelly that is not completely refined may contain PAHs, and these have been found to be potentially carcinogenic. But if you look at the big brands of petroleum jelly being sold out there, like Vaseline, they only contain completely refined petroleum jelly. And if you look at the back of the label, it's called white petrolatum. White petrolatum is completely refined and completely safe to put on your skin. So feel free to apply petroleum jelly on your skin if you need its occlusive and moisturizing properties. It is safe as long as it's completely refined. Like virtually all plastic surgeons, I was taught in my training that breast implants are completely safe, that they do not make people sick. And what we were taught was that back in the 1980s and early 1990s, there was a big hubbub around breast implants. And do silicone breast implants cause systemic illness in people? And because of this, in 1992, there was a moratorium on the use of silicone breast implants. This moratorium lasted all the way until 2007. In 2007, the silicone implants were placed back on the market because they were deemed safe for use. And many plastic surgeons believe that the lifting of the moratorium was essentially their proof that breast implants do not cause breast implant illness in women who have them. And this has been plastic surgery dogma ever since then, up until just the last few years. There have been tens of thousands of women who have shared their stories on internet websites and on Facebook groups, revealing their stories and their experiences with breast implant illness. Now, breast implant illness is a term given to a constellation of symptoms that may be related to breast implants. And these symptoms include thinning of the hair, unexplained rashes, chronic pain, brain fog, digestive issues, and so much more. Well, studies are now coming out showing that breast implant illness is most likely indeed a real phenomenon. And although there is not a lot of science still, and we need to do so much more research on it, I do believe breast implant illness is real. But unfortunately, for many years, I believed the dogma that breast implants just do not make people sick. And there are doctors who told me that the reason why women who have breast implants have symptoms that I've mentioned earlier is because they most likely had psychiatric problems. Yes, these doctors are claiming that some women who have illnesses from their implants, it's all in their head. And I think this type of reasoning is the epitome of the patriarchy in medicine. So I was wrong about breast implants. I do overall believe that breast implants are safe for the vast majority of people who get them. But I also believe that there is a small percentage of women who have breast implants or get breast implants who do get sick from it. And the proof is that when those implants are removed, anywhere from 55 to 85% of these patients, their symptoms significantly improve once the implants are removed. How many times have you heard a doctor say that as you get older, you should walk, and that walking is the perfect exercise, and if that's all you do as you get older, that is okay? Well, I have believed that myself for many, many years until I really started researching it and thinking about it. And the truth is that walking is a great exercise as you get older, but it should not be the only exercise. And it definitely is not the ideal exercise. So what is the issue with walking? Well, when you walk, you only use those muscles that propel you forward. And the muscles that you're using are called slow twitch muscle fibers. And these are muscle fibers that are used for basically endurance type of activities. But as we get older, one of the most scary causes of mortality is breaking a hip. In fact, one study showed that 1 out of every 3 people over the age of 50 who break their hip will actually die within 12 months of that injury. That is a horrifying statistic. And the way that walking works into this is that one of the ways that people break their hip is that they fall from a standing position, often sideways. So if you are walking and doing any other type of standing activity and you lose your balance and you're about to fall, what helps you to then stabilize your body and prevent yourself from falling and maybe breaking your hip? It's the fast twitch muscle fibers. These are the muscle fibers that are used by your body for explosive and quick action. And those muscle fibers are not worked out when you are walking. The way to work these muscles out is to do strength training. Now, I have a good friend of mine named Deborah Atkinson, and she is an exercise expert for people over the age of 50. And she recommends 3 specific strength training exercises that can help anybody as they get older with their fast twitch muscle fibers. These exercises are squat or leg press, chest press, and rows. If you do these 3 strength training exercises, you can work virtually all the fast twitch muscle fibers that you need to hopefully keep you nice and limber and prevent you from falling and potentially breaking your hip as you get older. So walking is a great exercise as you get older, just don't limit your exercise to just that. Now, there is so much that we can do to reverse the aging process as we get older, and a lot of it, unfortunately, is not taught to you by traditional doctors. Did you know that you can look and feel upwards of 10 years younger using your body's own rejuvenative abilities? And this is a process that I call autojuvenation. And I've created a revolutionary plan that virtually anybody can follow that does just that. By eating a collagen-supporting diet, by promoting intracellular renewal, by very carefully timed intermittent fasting, and using the right clean skincare products and nutritional supplements, you can look and feel years younger in as little as 3 weeks. Now, I cover this in my new book, Younger for Life, which depending on when you watch this video, you can either pre-order it now or purchase it now. It's a culmination of 25 years of being a plastic surgeon and a doctor, and I am so proud of it. And we have a ton of free gifts if you pre-order or purchase it today. Please go to autojuvenation.com for more details. I'll provide a link in the caption below. During my residency training, one of the things that I really wanted to learn was how to do Asian eyelid surgery. Essentially, how do I create an extra crease in the eyelid of Asian men and women? So I learned this procedure and I was so excited to perform it in my practice because honestly, as a Korean American, I just thought I was supposed to do that. But after performing the surgery on a couple of women, I started thinking that maybe this was not the right thing to do. So I stopped performing the operation, but it wasn't until several years later when we had my second baby, who was a girl, that I decided it definitely was not the right operation for me. My daughter was born without the extra crease of her upper eyelids, kind of like me. And the thought that she would need to go under the knife to feel beautiful, honestly, was a horrifying thought for me. I knew that my girl was the most beautiful girl I had ever seen in my life, and I do not believe that she needs anything done to make her any more beautiful, whether in my eyes or somebody else's eyes. And so I made the decision at that time that I would never perform this operation. However, I also do not judge anybody who has it done or who performs the surgery themselves. In fact, I do get people who call my office asking for the operation, and I often refer them to other plastic surgeons who are really good at the surgery. But when it comes to me and myself, it's not an operation that I'm interested in performing anymore. I cover my thoughts on Asian eyelid surgery and other Asian types of operations and whether they may be trying to essentially Caucasianize the Asian appearance in a previous YouTube video, and you can check it out right up here. I believe that there is beauty in all different ethnicities, all different skin colors and skin types. And this trend that we're seeing now with extreme plastic surgery on Asian women really does make me sad. If you go to any of the doctor's lounges in any of the hospitals across the country and you start talking about chiropractic or chiropractors or naturopathic doctors, you will be met with a lot of snickers and probably insulting types of statements. MDs and DOs traditionally are not all that open to respecting these other types of healthcare professions. And I was one of those when I went through my training as well. I always considered chiropractors and naturopaths as being essentially quacks. that because they were not necessarily recommending the things that we recommend as traditionally allopathically trained physicians, that there was something wrong with them and that they were just plain wrong, period. But now I know that that is not true. During traditional medical training, we get very little education in one of the most important aspects of healthcare, and that is nutrition. I know so many chiropractors and naturopaths who know so much more about nutrition than probably 99% of physicians practicing today. And just because they don't have an MD or a DO after their name doesn't mean that they don't know more than doctors who do. In addition, I do believe that the ideal method of healthcare is a truly integrative approach that combines traditional medicine with alternative medicine. Now, obviously, there have to be some caveats. Traditional medicine is great at treating acute problems. If you get in a car accident, if you've got pneumonia and you can't breathe, if you've got an acute condition where you are very sick, you really need to go see a traditional physician and use our traditional healthcare system because you will have the best chance of surviving if you do. However, our traditional medical system fails when it comes to preventative care. And that's where I believe that the naturopaths and the chiropractors are so much better oftentimes than we are. And they are oftentimes better at promoting healthy lifestyles, getting rid of environmental stressors, encouraging proper nutrition and other preventative ways to stay healthy. Now, there are certain practices in both chiropractic and naturopathy that I may not agree with, and that's okay, but I do think that we all have the same goal in mind, and that is to create health in our patients. So I was wrong about chiropractors and naturopaths back in the day. They can and do often play a very important role in the healthcare ecosystem. So these are 5 things that I was wrong about, but what about 5 cosmetic procedures that if you get them, you will regret them? Well, I covered those 5 procedures in the video right up here. And remember, eat real food, use clean skincare, and auto-rejuvenate before you operate.